Optometry is in a really unique position when it comes to glaucoma management, especially with this evolving world of MIGS procedures, because we really are the gatekeepers for a lot of these patients. A lot of times optometry is who's making that initial diagnosis.
When you look at the data on this, by the year 2030, there's going to be 4 million Americans with glaucoma. By the year 2050, there's going to be 5 to 6 million Americans with glaucoma. And ophthalmology and optometry are going to have to work together in order to take care of these patients. And the primary goal for an optometrist is managing glaucoma, intervening early, and educating on all the different treatment options that are available, whether that be topical therapies, whether that be minimally invasive glaucoma procedures, whether that be glaucoma drug delivery, and then co-managing or be a part of the conversation with ophthalmology to provide the best care.
I think that optometry's role should be very active when we're dealing with MIGS. And I really think when I say an active role, it means you need to first know what the options are for your patients, educate yourself. Sometimes that means reaching out to the surgeons in your area to see who's doing what procedures, getting to know what their skill level is with the procedures, and then really educating your patients. So patients oftentimes don't realize that that glaucoma management isn't always in a bottle, that sometimes it is in a procedure base with these MIGS. And I think really optometry being an active role in the education of our patients is really going to go a long way.
So when we think of challenges in glaucoma, there's a lot of them. And probably if I had to pick one, it's probably compliance. Our patients just don't use medications the way that they're supposed to. And so if we can minimize the medication burden for our patients, that doesn't mean eliminate drops completely. It means just minimizing the burden. Taking patients that are on 3 drops to 2, 2 to 1, or even 1 to 0 will be beneficial. And we now have safe procedures like minimally invasive glaucoma procedures that we can intervene early in the disease process to minimize that medication burden.
I think the greatest challenge that we have with glaucoma is that there's no cure. We need to manage our patients. Traditionally, that's been putting the management up to the patient with compliance with medication, drops, etc. I think that if we want to have our best chance for patient outcomes to be great, we really need to be the ones to steer that ship. Optometry has a great opportunity to be able to help these patients by being more proactive in the interventional glaucoma space.